All right. Well, we are edging towards 50 people, so I think we should begin, and to respect people's time. I'm Jessica Collins, Executive Director of the Public Health Institute of Western Mass. And like I said before, I'm just so honored to be with this just incredible panel of women talking about a very important issue, sexual violence towards girls and women. And I wanted to just begin by setting the context of, we have here the co-founder, Cindy Miller, of the Yeah Network. The other co-founder, Dr. Sarah McAdoo-Prez, I'm not sure if she was able to, but many, many years ago started the Yeah Network, which was about focusing on youth health, empowering youth, particularly to get at teen pregnancy rates, of which that coalition did an amazing job. And through the years of working, there was a conversation that came up about some root causes of teen pregnancy. And so we wanted to discover and dig deeper a little bit into what about sexual violence and what about that root cause for girls, and that puts folks on a path for potentially becoming a teen mom. And so we were really lucky at the time to have joined our team, Jessie Gleckel, who brought expertise in this content area. And she raised her hand and said, yes, I want to take this on, and I want to dig deeper, and I want to help us understand, what is the data? What are we learning? What do we need to know? And so I'm really just so grateful, Jessie, that you were able to come back today and present what your hard work for years in the making, I'm sure you'll share. And so we have such an incredible group here today. And I want to start off by introducing our board member, Luz Lopez. She's the Executive Director of MetroCare of Springfield and serves on our board. She's a mother of 2 wonderful children, was born and raised in Springfield after her parents and siblings migrated from Puerto Rico in the late 1970s. And at a young age, Luz began advocating on behalf of her classmates as the student council president, believing that all people should be loved and respected. And in 2016, she founded MetroCare of Springfield, which provides adult foster care services to individuals who require assistance in order to live safely in the community. She also serves on the Baystate Medical Center Community Benefit Advisory Council. She also serves on the Baystate Healthcare Alliance Board of Managers. Luz is a recognized leader in our region. And Luz, I'm just so grateful that you're going to moderate this important conversation, and I'll hand it over to you.
Great, thank you, Jessica. Hi, everybody, and welcome. So I would like to start off by introducing Ms. Jessie Gleckel, MPH. Jessie is the Director of Programs and Standards for the Connecticut Alliance to End Sexual Violence, the Alliance. She has 20 years of experience in local, national, and international public health practice, research, and evaluation. Her work has largely focused on sexual and intimate partner violence prevention and research, sexual and reproductive health and rights, correctional health quality improvement, and HIV/AIDS prevention. Prior to her role at the Alliance, Jessie served as a senior research associate at the Public Health Institute of Western Massachusetts, and as a health scientist and gender advisor in the Division of Global HIV and TB at the Centers for Disease Control and Prevention for 6 years. Jessie completed her MPH in the University of Washington's Community-Oriented Public Health Practice Program. So welcome, Jessie.
Thanks, Luz. And I appreciate so much that you put in that you're a mom in your bio. I have to change that up because I too am a mom of 2 beautiful children, and I am terrible about putting that into my bio. So thank you for inspiring that, because I'm going to change it up next time. I love that you have it in yours. Okay, so I am going to share my screen. Oh, I can't share my screen.
While we're figuring that out, I just wanted to say, I forgot to say that please feel free to put your questions in the chat box. And then if the presenter can be nimble enough to answer it on the fly, she will. If not, we'll field them later. And also if people could please continue to be muted until we, get to your question, we would appreciate that.
Yes, Jessica already asked me if I could do that. And I teach a course and I'm terrible at doing two things like that at once, but definitely interrupt me if you have a pressing question and I'm skipping over something too quickly. As Jessica said, this is a little bit of a labor of love. We took this on kind of a while back now. I don't even know when we started, to be honest, but we had a number of kind of revisions that we made throughout the time, and I since left the organization. So I'm a little rusty on the data, but I've been trying to catch up over the past week. And so feel free to jump in if I miss something or I go over something too quickly. I have about 10 minutes, so it's going to be pretty brief, but stop me if you have questions. So we took on, as Jessica was saying, based on some interest by the network and folks who kind of were still working with that network or kind of convening as interested parties around sexual health for adolescent girls and young women. We really took on this environmental scan, and what we decided to look at was existing data, programs, and policies that really affect sexual violence against girls and young women in Hampden County. And the reason for that was really to build off of the work that the YAN network had done and some of the anecdotal information that had been heard during that time frame of that program. And to acknowledge that there's some really clear overlaps between the experience of sexual violence, of sexual and reproductive health issues like sexually transmitted infections, unintended pregnancy. And there's a lot of literature to support where these different health issues for adolescent girls and young women overlap. We didn't include very much of this in the report. There's a little bit, and then there's some in the appendix because we thought it was really important that it be acknowledged and that there be recognition of that, but that it not be the bulk of the focus of the report. So I won't be speaking to that part today, but it is in the appendix of the report. So I just want to start with a little bit of additional background. Which really is around sexual violence, as many of you know, as a pervasive public health problem globally. So it's something that we see across the globe. It is experienced by people of all genders, not just women and girls, and not just cisgender females, but all people of all genders, all races, all ages. It is one of probably the most pervasive health problems in terms of it not being scarce to any one particular population. You can see that nearly half of all females and transgender individuals and about a quarter of males report sexual violence involving physical contact in their lifetime. That's an incredible amount. And if there were any other health problem that we saw affecting that number, that portion of our population, we would be up in arms and throwing so much more money at it than we do around violence. In terms of adolescent girls and young women, we see even higher increases in their risk of experiencing sexual violence when they're adolescents, and particularly among girls. Females in Massachusetts who had experienced and reported rape through a national survey, among them 41.2% were younger than 18 the first time they experienced a rape, and 42.1% were between the ages of 18 and 24. Now, this is just their reports of rape and doesn't include other types of sexual violence. So when we're talking about sexual violence and throughout this report, we're talking about forced sex that was completed. We're talking about attempted rape. We're talking about coerced rape. We're talking about some sexual violence that's non-contact. So it's a very broad term a broad definition that we chose, which was really around sexual activity when consent is not obtained or freely given. So it could be many, many different acts. And so for these statistics I'm showing here, these are just rape. So thinking about all those other types of sexual violence that a young person, especially in their childhood or in adolescence, could experience, we are talking about numbers that are so much higher than what we're actually seeing here. So as we talk about about sexual violence as a public health problem, I think it's really important that we look at, the World Health Organization and CDC have both kind of outlined this public health approach to violence prevention, which is what we look at in terms of addressing pretty much any other public health problem. And it's really rooted and grounded in good data. And so this is part of the thinking around this project and what we needed to try to understand around how do we understand the problem and how do we try to really address sexual violence in Hampden County and beyond, without truly understanding the extent of the problem, without really understanding the data. And so we really try to kind of focus on that as kind of the heart of this assessment. So as I said, community partners were interested in improving response to sexual violence among adolescent girls and young women from their work in the YAD network. There was a lot of discussion around there being a need to understand scale and scope of sexual violence. So what is the prevalence? How much violence are girls really experiencing? What is the context of that violence? And so these are some of the questions that we started kind of talking about. And really, we wanted to know, like, has anyone really looked at this before? And we couldn't find anywhere that there had been any sort of systematic look at sexual violence among adolescent girls and young women in Hampden County, in Western Mass, and really in Massachusetts more broadly. So we developed a SCAN plan and we convened a group of wonderful advisors. And so we had a really fantastic advisory group. You can see the list of them. I'm not going to go through them all, but I will talk through a little bit of their composition. But they really were a critical component of this process as they kind of gave us feedback throughout the whole process. We identified and collected various sources of data. Only one source was primary data collection, and it wasn't through this project. It was, and what I mean by primary is that we collected new data. And that was the youth health surveys through the Springfield Public Schools. Otherwise, we were looking at existing data sources and doing new analyses, so secondary data analysis on those. And then we wrote and vetted the report multiple times with the advisory group, who was so patient with us. And so I'm so appreciative of all their feedback and all their patience as we kind of worked through that. There were three main objectives as we kind of worked through this. The first was to really determine this current state of data measuring sexual violence. We were looking at prevalence. We wanted to understand incidence. We wanted to understand what the context was for adolescent girls and young women. We wanted to understand the current state of services. So what exists in the community in terms of the response and prevention that was going on to be able to help girls and young women who are experiencing sexual violence. And we wanted to understand policies and systems and what kind of funding exists in terms of being able to actually support this work being done. So like I said, we had a great advisory group. Oops, sorry, getting ahead of myself. They provided quite a bit of guidance, input, subject matter expertise, and there was really impressive composition from this group. We had public health professionals, we had folks from healthcare, sexual violence, exploitation, child sexual abuse, and human trafficking experts, and amazing people who are doing the work every day from the social services. So we really looked at what data existed. And so we had identified some sources and then really asked our advisory group to help us identify more. And what we were able to come up with was this list. So we had law enforcement related data, which we got from the Massachusetts State Police Crime Solve. The Department of Public Health was able to provide us with reports from rape crisis centers around the state, and specifically the Rape Crisis Center in Hampden County, which is the YWCA. And then the Executive Office of Public Safety and, I always mix it up, Safety and Security, I think. And they actually collect provider sexual crime reports. So that's medical providers predominantly who are collecting reports once an individual comes in for medical care and reports that they've been sexually assaulted. And so then they fill out a report and then send it up to the state as well. Different department in the state. Service providers were able to provide us some programmatic data. And the Public Health Institute of Western Mass is conducting with Springfield Public Schools, the Springfield Public Schools Student Health Surveys, the Youth Risk Behavior Survey and the Youth Health Survey. So I'm going to go through just a few findings, some key findings, and things that we learned from this. We kind of really organized the report. You'll see into a few different these three big areas, but you'll see in the data, because the way the data kind of came to us and we were able to kind of analyze it, it's sort of organized by both kind of almost like subtopics of sexual violence, but also by the source. So you'll see that we kind of tried to analyze kind of what was available by the different sources that I just went through. I'm going to just kind of give a little bit of summary here. So for data, our major findings, and most of you, I'm guessing, are not going to be particularly surprised by some of these findings, right? That the sexual violence data are not centrally collected. So there isn't one source of information for sexual violence, right? You saw that I listed all these different places that we got it. They're not all housed in one place, right? So they're not all centrally collected. They come from different places. There are multiple sources of SV data. And so what I mean by multiple sources is we had law enforcement, there's healthcare providers, there's crisis services. So all these different places that a victim or survivor can come to report their violence. And then that gets reported up to another level usually. And the sexual violence data really only reflected reported incidents. So what that means is that, like I said, someone had to actually go to a healthcare provider, go to a crisis service center, go to the police for their experience to have been kind of recorded, right? And so anyone who just feared reporting their experience of sexual violence is not recorded anywhere, right? And we know that this is a highly stigmatized, very shaming experience still to this day. So even though we have changed a lot in the way that we respond and we educate around sexual violence, there is still a lot of shame and stigma around being able to report. So we know that what we see is a high underreporting and much lower numbers than what is reality. There's the possibility that some of what we have is duplicative, because someone may have reported to the police and a crisis service center, or a crisis service center and a healthcare provider. And so that could be duplicated information. And also the school health data that we looked at, that the Public Health Institute helps collect with the Springfield Public Schools, are the only population level data that we have. So that is kind of like the opposite of what I was saying in terms of reported incidents. Reported incidents aren't representative of a population, but when we do when Public Health Institute or anyone conducts a survey at a school level or in the community, that's actually getting at a population level data. And we can usually use the data if the response is good enough, high enough, then we can see it as generalizable across a population. Oops. Sorry, Prezi's a little new to me still. So I'm just going to give you a couple highlights of what some of the data told us. We saw that 43.7 to 53.8% of victims were adolescent girls and young women. So AGYW is adolescent girls and young women. And we really were looking at about 12-year-olds to 24-year-olds here. And the reason I put a range is because from the different sources of data that we had, this number shifted a little bit, right? But it was all right around about half of the victims that were being recorded by these different sources, law enforcement, rape crisis centers, and the provider reports, sexual assault reports. Those were all about 50% were adolescent girls and young women between 12 and 24 years old. You can see here, this one is just one dive a little deeper to looking across ages at the experience of sexual assault by age, that this is from the law enforcement set of Mass State Police Crime Solve. So you see over here, 10 to 17-year-olds are making up about a quarter of those victims, both in Hampden County and in the state more broadly. And the numbers kind of stay among higher until we get into people in their more into middle age and older adulthood into 35. We didn't tackle anything around younger children, but I did want to highlight here this finding that we had about under 10 in Hampden County, and this 9.8% being quite a bit higher than the statewide of 5.9, which was a little shocking, I think, to all of us when we saw those data. So we also looked at non-consensual first sex, and this was based on the data that we had from the Springfield Public Schools Health Survey data. And what we asked students about was about the characteristics of the first time they had sex. So these data are of those students who said they'd ever had sex, right? So of those, 31.6% of 8th grade girls who'd had sex before reported that the first time they had sex, it was coerced. And this is about twice that of their male counterparts. We asked them to kind of categorize or like actually describe how they kind of thought that non-consensual first sex was for both 8th graders and the 10th and 12th graders. So the 8th graders complete the youth health survey, the 10th and 12th graders complete the youth risk behavior survey. The questions were very similar. You can see that it was a little different of the experiences between the 8th graders and the 10th and 12th graders, but the 10th and 12th graders experienced a lot more verbal persuasion to have sex the first time versus the 8th graders who experienced more pressure through harassment, or this is more like kind of coercion, we kind of would say, pressure through harassment or threats or coercion. And then also the 8th graders experienced much more physically forced first sex, twice that of the 10th and 12th graders. So the other big finding that I just wanted to quickly talk through was just the data gaps. I mean, this is kind of what we anticipated, I think, when we kind of ventured into this. And I think the advisory group as well, like as we talked through it, everyone on the advisory group was kind of like, oh, you know, this is important because we know there's not a lot of data out there. And so we really want to do this. And we think it's really important. And doing the scan really confirmed that for us, right? That there's no existing population level data for Hampden County around sexual violence more broadly. Like I said, we do have some data for school age children who complete the youth health survey or the youth risk behavior survey, but even that is just a small amount of data. The data can't show overall extent of the problem. So when we look at the data and we look at what we can see from the rape crisis centers and from the from program data, from law enforcement, we're seeing kind of snippets of what is going on for the problem. We don't really see the true extent. Like I said, it's not population level. There's little bits of information that might be missing from each one of those sources. And they don't necessarily represent the full geography of Hampden County. This is information that we weren't able to really dive into. So as we collected information, you know, parts of Hampden County are pretty rural, and we know that like the only rape crisis center in Hampden County is the YWCA. Not that they're the only ones providing rape crisis services, but they're the only ones at a rape crisis center that's in reporting up to the Department of Public Health. So when the Department of Public Health pulls down those data, we only see the YWCA's as a rape crisis center. And so if there's other stuff going on outside of Springfield and people are having trouble accessing those services, we're not able to even look at that or understand what some of those limitations might be. Trafficking data for young women is not currently available in Hampden County, and this was originally one of the intentions of the advisory group was really interested in looking at trafficking. We do have data from Baystate Family Advocacy Center on child exploitation, but they do serve young people up through about the age of 24. But there's not actual data being collected for young women specifically around trafficking and their experience around trafficking currently, or at the time of this report. Maybe there is now, but at the time of the report writing, there was not. And then public access to the data is limited. So most of the data that I was able to access, I had to go through, you know, a process of making requests to the Department of Public Health, to the Executive Office of Public Safety and Security. And so these are not readily available public data sets at this time. many of you are probably very aware of the existing programs and services in Hampden County, and these is just a little bit of information about each of them. There's a little bit more in the report, but just to say there are some really, really great services that exist in the community, and that they are collecting some really great data too. Related to the services that they're providing. That still is limited to just those that they're actually serving. So it doesn't provide information more broadly about the broader community and those who might not be accessing services for one reason or another. The last kind of piece of findings that I was going to share just really, really briefly is we did look a little bit into policy and budgetary line items that are in the state's budget for providing funding to help prevent and respond to sexual violence, intimate partner violence, even I think trafficking as well. And there are some really what seem to be well framed and well articulated pieces of legislation, as well as really consistent budget line items to be able to continuously support coalitions and rape crisis centers doing this work. However, we did not take on kind of a policy analysis for this report in this scan. And so to really understand the extent of how successful these policies are in actually being able to be implemented and to be able to hold people accountable and provide the services that they say are critical for prevention and response, a full policy analysis would need to be done. And the last piece is just two major recommendations from the advisory group came out of this assessment. There was a lot of talk around the importance of screening for violence, but the group really discussed how that was the large limitation to be able to do that is the need for more data to be able to appropriately screen, right? To be able to identify appropriate locations to screen, understanding the context in which the screening would take place. And so that kind of brought us all back again to this, to the gap in data. And so the group really decided that the two main pieces would be to identify a process for systematic sexual violence data collection in the county. So how could it be done that we could more regularly collect data that is at a population level and is more representative of and clarifying what the extent of the problem is. So that was one piece. And then the second piece was to create a task force to help really guide understanding the data gaps and to figure out a more coordinated response based on being able to fill those data gaps and understand the data better and be able to create a more coordinated response to sexual violence in Hampden County. There's a lot more in the report. So I hope folks will take some time to kind of look at it. There's some more graphs, there's a lot more data. That is pretty much what I have.
Great, thank you, Jessie. We have a few questions in the chat that I'd like to read for you, if you can take a few moments. We also will have time at the end. We'll have about 10 to 15 minutes for more questions and answers. So our first question here is from Colleen. Bravo for looking at this data and this project in general. Are other regions in Massachusetts doing anything similar?
Actually, Dawn might be a better person to answer that based on her work with the commission, but so I'm not entirely sure.
I don't think it's happening. I think my friend Donna from the Women's Fund is on this call as well, and they did their report on the status of women and girls, and I think there's just an overarching prevalence of lack of data or lack of action because of the lack of data as well. So not that I know of is the clear answer, but others may.
Okay, thank you. Great work and important conversation. Wondering about the extent in which disability status is captured when looking at prevalence of sexual violence against women and girls.
Not very much. That was Jennifer's question. Such a good question, and not very much at all. There was like pretty much nothing in the data or in those data sources. I've seen a little bit in more national data sets that speak to high levels of sexual violence among those with physical and mental disability or cognitive disability, and how prevalent it really is, but how incredibly understudied it is, even more so than the general population. So yeah, unfortunately, wholly not representative at all.
Jessie, if I could jump
Okay,
in,
and there was actually two
Oh,
questions.
sorry, go ahead, Dawn.
Sorry about that, Luz. I didn't
Sorry,
mean
Luz.
to interrupt you. I do know from work that the YWCA was doing years ago, and back in 2006 and 2008, we had a partnership with Goodwill Industries, and the rates of sexual and physical violence against people with disabilities hovered at 93 to 94%. So those are national statistics, but they're atrocious. So.
Okay. So we do have a comment. It says there is a Metro West Women's Fund outside of Boston. Okay, thank you. So
Sorry, there's one more than, and it's a great question, and I should have mentioned it, and I kind of had it in my notes and skipped over it from Megan. Yes, great question, Megan. And this was actually something that we did see and was and is consistent with national data, which is that that victims, almost like 3/4 of victims, tend to know their perpetrator, right? It tends to be someone that they're familiar with. It could be, and there is one, we do have a graph in it. I didn't end up putting it in that looks like that, looks at it. And it was, I'm trying to remember the exact stats. I mean, it's over 75% of victims, survivors know their perpetrator, which is what's consistent with the data that where they did have the relationship to the individual who perpetrated the violence. Great question.
thank you, Jessie, and thank you everybody for your questions. So I also wanted to acknowledge a few of the Public Health Institute of Western Massachusetts board members. We have Joan Kagan, Jennifer Lee, and also Cindy Miller, who is our next speaker. Cindy Miller, Cindy's the Director of Sexual and Reproductive Health at Tapestry Health. Cindy manages the family planning program in Hampden County for Tapestry Health. Cindy's dedication to reproductive and community health is demonstrated in her career of over 30 years in public health, all in the greater Springfield area. In addition to her work in clinical administration, Cindy is active in many community coalitions and mayoral commissions. Cindy is a member of the Springfield Maternal Child Health Commission, Project Baby Springfield, Springfield Chana, the YA Network, Springfield Adolescent Sexual Health Advisory, and is the chair of Holyoke's Mayoral Commission on Teen Pregnancy, and vice president of Ludlow Cares Coalition. Cindy has twice received the Ellen Story Award to recognize her work for exceptional contributions to the Tapestry Health, as well as numerous other awards. Cindy received her Bachelor of Science degree in Community Health from Springfield College in 1982. She lives in Ludlow, Massachusetts with her husband, John. She has 2 children, Jen and Mark. Cindy, thank you for joining us.
Well, thank you. So people who may not be familiar with Tapestry, we have offices located throughout Western Massachusetts, including 6 reproductive health clinics, 5 harm reduction offices, which provide syringe exchange, as well as other harm reduction services. And we also operate 3 WIC programs in the greater Springfield area. Tapestry's sexual and reproductive health clinics are oftentimes the first providers that young people disclose their trauma to. Except for mandated abuse cases, much of what is disclosed doesn't go into any database. So we're not able to collect these incidents of violence and to truly understand the extent of the problem. Next slide, please. So common types of violence that we see in the clinic. Because Tapestry offers services to young people under 18 who are seeking reproductive and contraceptive services, we always explain to individuals, to minors, that we are mandated reporters, and if they do disclose to us, we have to report. But we screen individuals by really starting a conversation with them in regards to asking them a variety of questions. And we do get positive responses that indicate either current or previous trauma. And the majority of what is reported is sexual abuse. Probably the most common disclosures that we get really are around relationship abuse, where partners are really trying to control and maintain power and control over the individual. These range from psychological abuse, like constant texting, stalking, isolation from friends and family, to true intimate partner violence. All of these increase people's risk to sexually transmitted infections and pregnancy. Specific examples, we like to talk about it in terms of reproductive coercion, where partners interfere with individuals' contraceptive use and pregnancy decision-making. One of these aspects is birth control sabotage, where partners actually make it hard for people to use contraception by holding back or destroying their birth control pills, for instance, ripping off their contraceptive patches, pulling out vaginal rings, and poking holes in condoms. So the other one that we see really is more around pregnancy coercion. And these generally are threats or acts of violence that if the partner doesn't comply with their wishes around the decision-making around whether to continue a pregnancy or to terminate a pregnancy. We are a main source of pregnancy testing up and down the River Valley and the Berkshires. So we do a lot of pregnancy testing, and we have clients who report to us that their partners are threatening to leave them if they don't get pregnant, and threaten to hurt them if they don't get pregnant, don't agree to get pregnant. And then in terms of women who do find themselves pregnant, is really interfering with the decision-making process of what they want for an outcome to that pregnancy. So oftentimes they're forcing a woman to terminate the pregnancy against her will, or the woman wants to continue the pregnancy and isn't able to, or is forced into a termination. So we have conversations with people about these signs of really unhealthy relationships and try to offer strategies as well as supported referrals. Tapestry is also a unique place because we're amongst the providers in the community that people utilize to report sexual assault. Many people in this age group of 12 to 24 already utilize Tapestry Health Services, and we have a reputation, and we've built a safe place for people to be able to go and receive confidential services. In addition, many people, and including college students, we have a large college population up and down the valley, don't have any other local provider in the area that they've established with. And then others come to us because of the stigma of sexual assault and feel that they can't go to their established OBGYN because of the stigma or walking into an emergency room. We do explain that we don't really have the capacity to do any forensic testing, but commonly we're not seeing people until many days or even weeks after the sexual assault. And their main concern when they come into the clinic is around, if they've been exposed to a sexually transmitted infection, HIV, and or pregnancy. Over the last several years, we've seen a disturbing increase in the number of clients who have come in reporting that their assault occurred under the influence of date rape drugs as well as alcohol. But the date rape drugs, we definitely have seen an increase over the last several years. We have one clinic who recently informs me that they've seen a huge increase in sexual assault disclosures coming through the clinic since the onset of COVID. Also, human trafficking. Tapestry, again, is a place where many young people who are being exploited already are utilizing our services because of some of the same factors I've already noted. So over the last several years, we've increased awareness around the issues with our staff and have increased screening around trafficking and have added to our referral resources. Next slide, please. So what have we done around addressing coercion and violence? Tapestry has almost always had a policy of speaking to clients initially alone. Right now during COVID, we're seeing people individually, but when people come into the site, either with a partner or another individual, we always ask to speak to that person initially alone so that they can share with us information that they may not share if there was somebody else in the room. And then if they so wish, the person can then join them for the rest of the visit. We feel like that's a really important aspect of initiating the visits. Over the last several years, we've revised our protocols to make sure that we're screening for violence at least annually. And any other time that we notice factors, we have some suspicion that some violence may be going on. One of the things that we have also instituted is in our electronic medical records, we have instituted prompts so that, we're making sure we're capturing the data and making sure that it's happening minimally annually. When we revised the protocol, we realized we needed to provide additional staff training to folks. So we really have trained staff to normalize the conversation. So we start conversations by saying, we ask this of all of our clients, and things like, we know all couples argue at some point. We provide our counseling staff and clinical staff with conversation starters to ask the questions as part of a discussion versus just asking pointed questions about people's potential abuse. We make sure that minors understand that we are mandated reporters. And during the process, when people respond negatively that they haven't, we thank them for answering the question, and we let them know that if in the future they need our help, we are here to help them, and it's a safe place to be able to discuss intimate relationships. So the person may not be ready to disclose at this point, but they know at least down the line that it is something that we're able to help them with in the future. And with positive screens, we always make sure we thank them for sharing. We affirm them by letting them know that they're heard and believed, and they're not at fault, and they do not deserve deserve this treatment. And then we also have had other folks come in to provide trainings like the Baystate Family Advocacy Center, the Hampshire County DA's office. And each year we have our local domestic violence agencies come in to do a training with staff, and also to get to know staff, because supported referrals are a lot easier when you know staff, they know what you do, and we've met each other. So we are able to let the clients make that phone call from our office in a private space, and we know the people at the other end of the phone. We also provide people with palm cards from Futures Without Violence that gives them a lot of information, a lot of national hotline information, as well as cards for local domestic violence programs. And we also leave those in discrete areas so that people can pick them up as they need to, bathrooms and exam rooms where they're left alone. Tapestry really strives to reduce stigma, and we want people to know that we're ready to help people when they need us. And mostly that we believe them, they're not alone, and that it's not their fault. During COVID, we have noticed, next slide, please, that we've noticed a few things in regards to COVID, that more people are reporting less ability to leave the home for any period of time, which makes it harder for teens and for adults as well to be able to explain their absence, to be able to access services. And also housing insecurity and income security is being reported more often, which is going to make people have it harder for them to be able to leave a situation. And more clients are reporting depression. So Tapestry is where people make that first disclosure oftentimes. A lot of times people will say to us, no one has ever asked me about this before. So unfortunately, though, people disclose and we can offer help and referrals, and we don't have a mechanism to really collect data. So we certainly support a way to confidentially collect this data for research purposes and to be able to provide data for potential funding to address violence among young women in the future. Thank you.
Thank you. Thank you, Cindy Miller, for that. We don't have any questions in the chat right now, so we're gonna go ahead with our next presenter. And at the end, like we said, we're gonna have a lot more, or we're gonna have some time for questions. Okay, so we have Deidre Hussey, PsyD. Deidre is a clinical psychologist and victim services supervisor at Baystate's Family. Can you guys hear me? Can you hear me? Okay, I'm sorry. The internet looked like it went away. So Deidre is a clinical psychologist and victim services supervisor at Baystate's Family Advocacy Center in Springfield, Mass. In her role, Dr. Hussey oversees the forensic interview services, case management, and intake coordination for all victims. Additionally, she helps to coordinate the multidisciplinary response to child abuse in Hampden County with local partners. Dr. Hussey is a certified TF CBT clinician and provides a variety of evidence-based trauma treatments to children, adolescents, adults, and families who have experienced sexual or physical abuse, domestic violence, or have been impacted by homicide or community violence. Dr. Hussey is trained in psychological first aid and My Life, My Choice curriculum, and is a nationally recognized trainer in the core curriculum of childhood trauma and the forecast model. Welcome, Ms. Hussey, or Dr. Hussey.
It's okay. Thank you so much for the introduction. And thank you for letting me be a part of the panel today. And I will try to keep on time here for everybody. So definitely feel free to ask questions later, or you can reach out to me as well if you're looking for more information. But I just want to take a few minutes to review kind of what the Family Advocacy Center's role is in this area, and then also the countywide response that we've had. Particularly, I'm going to talk about sexual exploitation, but also to child sexual abuse and assault. So Baystate Family Advocacy Center, for those that don't know, we are part of Baystate, and we are also the Child Advocacy Center for Hampden County. We're a hospital-based CAC, and we also are seen as a trauma specialty clinic in the area. Our traditional role here as a CAC is that we provide kind of the multidisciplinary, trauma-informed multidisciplinary response to child abuse, which includes child sexual abuse and child sexual assault. As part of that, we have a coordinated process, coordinated and multidisciplinary team for forensic interviews that we can do here we collaborate very closely with the District Attorney's Office, DCF, and law enforcement. And our team here, our case management team, provides a lot of extensive services and follow-up to those families that come in following the report of abuse. And they can continue to follow that family into providing services, providing referrals, emotional support, court support, and they really work hard to collaborate with other agencies to connect them to specific services that might be a specialty area. At our clinic, we also have a medical exams that we can do by a pediatric specialist, and we also have therapy on site where all clinicians provide evidence-based practices to help kids and families heal from sexual abuse or sexual assault. In our trauma-informed therapy, we can actually serve up to age 24, which isn't always known. So that's really helpful that we're able to do here. And like I said, additionally, our case management team can provide lots of services to victims and families, even if they're not coming in for a forensic interview, but if they've experienced some type of sexual trauma. So I wanted to talk a little bit about, and I'll kind of put that together, but I just want to mention one of our specific services here is our One Mission program, which is what we talk a lot about more in the report. And our One Mission program is really specific to sexual exploitation. Its focus is to increase access to and coordination of services for those who are either deemed at really high risk or have experienced sexual exploitation. Our focus is really the child response. So we're really looking at youth who are under 18 who've experienced commercial sexual exploitation. However, because our services can support up to age 25 in that program, we also work with a lot of transition age youth, as was mentioned earlier. Within our FAC, we have kind of our FAC response. So we house the Hampden County CSEC coordinator. She works really closely to connect youth and families and agencies together and collaborate on services and provide coordination. We can provide the same services to those youth that we do for our CAC response, but we also have individual and group treatment that's specific to youth who've experienced exploitation or at high risk. So myself and some other clinicians who are trained in TFCBT received additional training to provide that to CSEC survivors specifically, or youth who are really at high risk, and we're really trying to work on prevention. We also have some of our clinicians and caseworkers who are trained in the My Life, My Choice group curriculum model that we've been able to provide and collaborate really closely with other residential and key programming agencies in the area to help provide that service for their youth. That is some of the work we do specifically at the FAC, but part of that group, there's also been a coalition that's formed in 2015-16 in response to the community. So really the community's need to address commercial sexual exploitation. And I saw a lot of participants in our coalition are on the call, so I'm really excited to see people on here. So feel free to jump in later if there's anything I missed. But our our coalition is focused on children, so that's really been something we've been focused on for the past 4 to 5 years. So it's the Hampden County Coalition to Identify and Prevent the Sexual Exploitation of Children. This coalition really provides us the ability to have the CSEC coordinator who really works to better interagency collaboration and the coalition really creates policies and practices and how we're going to respond to sexual exploitation, and then what programming we're going to do to connect youth and families to services that are going to help them heal and process. It's also really worked on supporting the prevention, which was mentioned earlier. So we do a lot of education and training in the community to really try to build awareness and identification of this issue. We also work really closely with the Massachusetts Children's Alliance, who supports having a CSEC coordinator in every CAC across the state. So we do a lot of statewide coordination, and our CSEC coordinator is involved in a lot of that work. And they recently hired a CSEC statewide coordinator through the Massachusetts Children's Alliance, who's going to really connect some of the work that's being done, not just in each county, but across the state. I just wanted to highlight some extra programming and practices that have come out more recently. So the Missing or Absent pilot program that came out of DCF is really highlighted on supporting youth who are missing from care. That program has some wonderful DCF workers who are really focused on trying to get youth connected and back into services and connect them back to treatment. We're working really closely with Robert F. Kennedy's new Legacy program. I think Megan Grant is on the call. And they recently started their program, which is about lived experience mentoring for youth. And I think they can work with those into transition age youth as well. But I want to highlight the coalition has over 25 agencies, from child protection, state and local, federal law enforcement, educators. I know local school members are on the call, faith-based organizations, youth services, mental health treatment, medical providers, businesses, and lots of criminal justice providers, lots of people who come together and I think have really supported a trauma-informed coordinated response to those who are really either high risk or have been sexually exploited. I think one of the challenges is we're really a child-focused coalition. So recently been working with the YWCA, which I'm sure they'll talk about, and really looking at some of the overlap there with transition age youth. And then I know there's more work being done recently in the adult-focused world. So I would say that's one of the challenges. I would just mention that during COVID, we did have a decrease in referrals to some degree. We get a lot of the referrals that come in are from other agencies, and that can create sometimes the challenge with data collection because we're not able to maybe get a clear representation of who this is impacting in the community. I know my team is working really hard on trying to improve our data collection process so we get a better or a more accurate representation of race, gender, ethnicity, what was mentioned earlier about disability status, so we can provide the most effective and culturally sensitive care to the families and the kids that we're working with. So that is a focus of ours, and something to think about as we continue with other programming. And then also just thinking about the transition age youth population in general. I think sometimes there's a lot of services that we've seen that can be really wonderfully child focused, and then others that are adult focused. So trying to find that middle ground, which we've worked with a lot of agencies recently who are doing some of that amazing work. So I hope I didn't miss anything, but I think I finished in the time. So thank you so much, and I look forward to any questions.
Thank you. To our next presenter, we have Ebony Steed. Ebony is a member of the Women's Fund of Western Massachusetts Young Women's Initiative. As a member of that important group, she serves on their Sexual Health Task Force for the Young Women's Advisory Council. She is 23 years old and was raised in Springfield, Massachusetts. She is currently a student at the University of New Haven, studying finance and English. Between classes, Ebony works as a banker at People's United Bank. Welcome, Ebony.
Hi, thank you, Luz. I really appreciate the introduction. So I just wanted to say hello to everyone. For those of you who don't know what the Young Women's Initiative is, it is a program, the Young Women's Advisory Council, that I was a member of. And I was introduced to it, and I did some research, and I was very happy to see all of the involvements and all of the relationships they have with different organizations. So when I was invited to speak, I was very excited to bring what we and my task force found to the table. So my task force was the Sexual Health Task Force. My group and I, mainly what we wanted to look at was which health issues that young girls face more, that they're a little bit more afraid to initiate or to act on or to ask for advice for. A lot of the girls in my group were younger girls. They were ages about 15 to 17. So me being 23, I was able to get kind of another data point from them. So that was always something that was good for me. So what we found was that, well, what I found reading the sexual violence report is that sexual violence is a direct cause from sexual health. So anything that happens from your sexual violence, relationships, they could lead to emotional health, mental health, physical health, etc. And a lot of the time, girls are not prepared enough to deal with those consequences. A lot of the girls in my group, I asked them if they did have a safe space that they can go to, that, to ask questions about their sexual health or about their activity. A lot of the girls said no, they didn't have someone who they were comfortable with talking about sex or talking about their health or like birth control or discovering any of those options. So that was very surprising to find out that they didn't have any place that they felt safe or comfortable to speak with someone about issues that they were happening. Another thing that I would like to touch on was that we wanted to find a way to kind of encourage men and young boys to kind of, take the pressure off of young girls also. Guys and men sometimes are more encouraged to explore their sexual activity, and they're a little bit more encouraged to do things like such. And a lot of the girls who said they didn't have a safe space to go to, they're kind of afraid to ask their mom for birth control or to even have sex, because that's something that girls are not supposed to do until they're married. And so that also can go hand in hand with the sexual violence, because if one person is told you are allowed to do this and another person is told you're not allowed to do this until you're married, there comes a lot of complications and a lot of issues in the relationship. So a lot of my girls were very forward in sharing with that with me. I was very surprised in the findings for the sexual report that we read here, that there were only a few organizations in the state of Massachusetts who actually are looking for data and trying to collect data on sexual health and sexual violence that women encounter. So that fact that there are very few of them that girls can go to kind of puts up the idea that there's not a lot of places for girls to turn to and be safe to talk about any issues that they may face. The organizations also who you can report to, you have to get it from the victim most times. And victims are often afraid to report acts of sexual violence because they're afraid to get a report to the police, and then it can cause another issue for them and their relationships along the line. So we wanted to find a safe balance between how can a woman or a young girl, how can she explain to people that she doesn't feel safe, and how, like, what other places can she go so she can feel a little bit more comfortable. So the YWAC organization was predominantly younger girls. They do search for girls ages 16 and older, and from the Springfield is a predominantly urban community. So there's a lot of there's a lot of different factors that go into what adolescent girls have to go through growing up. So my task force, we tried to identify a lot of the health issues that women face. They face menstruation, practicing safe sex, pregnancy, how to get an abortion, what to do if I get raped, what to do if I know someone who got raped. Am I the safe person that other girls can come to? So it was very interesting to see what my task force mates identified as issues to them, being they were 14 and 16, I believe. So those two ages, you know, they're really a little bit confused. They're like, I don't really want to ask for things because I'm scared that someone's going to tell me I shouldn't have it. Like, they don't want to ask for birth control because they're scared their parents are going to tell them you shouldn't have birth control, you shouldn't be having sex. But we also have to make sure that we identify with our adults and with our parents that, you know, it's okay for your kids to be doing, you know, some things, but they need help. So we came to the conclusion that we need a lot more help from peers who are men, you know, just trying to brush up on their information on their woman's anatomy and everything that happens to women. Because if you ask a man a question, you know, about women's anatomy, about women's health, they often don't know the answer. And, you know, about their health, reproductive systems, about safe sex, they often don't know. And, you know, women are always the ones who have to do birth control. So that was something else that we touched on. We wanted to make sure that they feel safe, you know, altering their hormones, altering their body for something if they wanted to. We want to make a safe space for girls to go to if they do encounter any acts of sexual violence. We want to make sure that they feel safe and comfortable reporting it, because we want the data to reflect the things that are actually happening. We don't want girls to shy away from organizations like all of these because they're afraid of what can happen in their relationships. So the task force did end a little bit early due to COVID. So hopefully this next round we get to keep the ball rolling and figure out anything that we need to do, work with any other organizations, and hopefully place our grant to somebody who will be very happy and encouraged to help us find safe places for people to go, and other ways and ideas, maybe even other task forces like the other one for the sexual health, where girls can go and discuss the better ways to confide in somebody, to ask questions, to feel safe. Because there's not really a lot of places for young girls to do. And that's kind of what we wanted to focus on. We want to focus on the comfort and the safety net that girls don't always have. So that's a lot that I have prepared for today. I don't see any questions in the chat, so I can just wait until the end. And I thank you guys for listening.
Thank you, Ebony. That was great information. Our next presenter that we have coming up, and we are a little tight on time here now, so is Elizabeth Dineen, JD. Attorney Dineen is the executive director of the 10th largest YWCA in the United States. Prior to this, she was assistant district attorney for 27 years in Hampden County. She was a prosecutor for 24 of those years. prosecuting domestic violence, rape, child abuse, and murder cases. Attorney Dineen also served for 4 years as chair of the Criminal Justice Department at Bay Path University. Thank you for being here with us today, Attorney Dineen.
Jessica, I got your message. I will try to keep this within 5 minutes. The YWCA has 163 employees. Its main campus is at 1 Plow Street in Springfield, and we have 23 separate programs. Some of our programs deal specifically with sexual assault survivors, domestic violence survivors, human trafficking, and stalking survivors. I'm going to just specifically focus on what we do for sexual assault survivors. We have 2 programs. One is the Children Who Witness Violence program, who is for kids between the ages of 3 and 18 who have been survivors of sexual assault or who have witnessed domestic violence. During the pandemic, we were able to keep that program alive. At the end of April, we put up 3 tents on our campus, and our 3 social workers work 6 days a week, delivering services outside in a very safe environment from 8:30 in the morning until 5:30 in the evening. And it was unbelievable the amount of kids that we had coming through that program. It was very, very successful. And the other program that we have that specifically addresses sexual assault, which has already been mentioned, is we respond to rape calls at 5 hospitals in the community. Baystate Medical Center, Mercy Hospital, Westfield, the hospital out there, Ring Memorial, and Holyoke Hospital. So anytime a woman goes to the hospital to have a rape kit, there's a call to our 24/7, 365-day-a-week hotline, and one of our advocates is notified. In the past, they would go to the hospital and be present to support the young woman or adult woman through the rape kit. Now we do phone advocacy, and we do follow-up care, meaning we have follow-up care, which could either be counseling or court advocacy to encourage them to pursue prosecution. One of the things I think that everyone on this call should know is that we did get, at the beginning of the pandemic, $1 million grant to deal with human trafficking. And human trafficking of teens was one $500,000 grant. And the other part of the grant was human trafficking of women 18 and over. So we are working with our partners across the United States who similarly got the grant. And we are starting to keep data so that hopefully the next time we do some type of deep dive like this, we'll have some concrete data to provide about who those survivors are, how they ended up where they are, and what's happening in terms of services and where they're going now. The last thing I want to just say is I am a member of the Governor's Council to address sexual assault and domestic violence. The governor has, this is my 3rd year on it, and he has assembled a task force of 30 people throughout the Commonwealth. And one of the things that was recently done as a result of that task force and as a result of every RRC, Rape Crisis Center across the Commonwealth, working in conjunction with the Governor's Council and our state representatives and senators, is get $8 million allocated to ending the backlog of rape kits. So there's been a tremendous increase in the number of rape kits that are processed quickly which has helped women feel as though their victimization is being recognized, meaning that the perpetrator is being pursued aggressively with the help of science. And in conjunction with that $8 million, there's been victim rights centers that specifically have been created to make sure that any young woman or adult woman who is a survivor of rape is made aware of all of the resources, financial, legal, and medical that are available to her at this point. So I think that's my 5 minutes.
Thank you, Attorney Dineen. Our next presenter is Don Forbes DiStefano, MPA. Don is Executive Vice President of Square One, a premier early education and care coordination in Springfield. Before Square One, Don worked at the YWCA of Western Massachusetts, working to secure funding and resources to support services and programs that empowered women and girls. Don received her Bachelor of Arts degree from the University of Massachusetts Amherst and her master's degree in public administration and nonprofit management from Westfield State University. She serves on the board of Dress for Success Western Massachusetts, Springfield Regional Chamber, Baystate Community Benefits Advisory Committee, and Businesses Against Human Trafficking. In addition, Dawn is the chair of the Hampden County Commission on the Status of Women and Girls. She resides in West Springfield, Massachusetts, with her husband and 2 children. Thank you for being here with us today, Dawn.
Thank you, Luz. I guess I have to update that. My children are now adults, but with the pandemic, they happen to boomerang back. So I guess it is true. They still live with me. I'm here today representing both Square One and the Hampden County Commission on the Status of Women and Girls. Most of you on the call are very familiar with Square One and know that we spend our day caring for the most vulnerable and at-risk children and families in the greater Springfield area. We specifically offer early education and care services for children aged 0 to 12 and families who are at risk throughout the city. 100% of the children we serve at Square One have experienced some level of trauma. They come from poverty, situations of poverty, hunger, homelessness, and certainly community and family violence. 30% of our children on average have an open case with DCF for abuse and neglect, are in the midst of homelessness, have a parent who's incarcerated or live with a teen parent themselves. So we know that these situations result in children who show up to our care every day with observable signs of low self-esteem, lacking relational skills, and sort of a delayed social emotional development. And in our classrooms, our teachers will often observe disruptive behavior and sort of struggles with their interpersonal relationships with peers and teachers. So what we've done at Square One, we have been recipients of some grant funding from local funders as well as some national funders to really address the early childhood mental health challenges that we've seen in our children. And it's a holistic approach to serving children. A more traditional approach to that type of therapy might be one-on-one or individual therapy, but at Square One, we have what we refer to as the Cornerstone Therapeutic Center, and that is where our children come, certainly for individual crisis work that needs to happen, but really for small group peer interaction and to work with their teachers and parents. And the parent-child sort of cognitive behavioral therapy approach we have there is sort of holistic. We see all of our children and our staff as needing that type of support and intervention. So it's been wildly successful. And so we're hoping to see that continue. I think Serving on the advisory committee, I certainly agree with the determination that we're lacking data. And our program here at Square One in the Cornerstone is looking to gather that kind of data so that we can more appropriately serve children age 0 to 12, certainly noting the 4% higher rate of sexual violence of children under the age of 10 in Hampden County. That's a concern to us at Square One. On the Hampden County Commission on the Status of Women and Girls, that commission exists. There are 9 commissioners in Hampden County. And our job is to listen, document, and advocate for policy and legislation as it pertains to the needs of women and girls. And certainly sexual violence is something we hear about often. We meet monthly. We also engage with the public through public hearings. And I wanted to mention to this group, in November of 2018, we had a public hearing where over 10 young women testified. Some of them are involved with the Young Women's Initiative, like my friend Ebony. In fact, Ebony was on our commission hearing last night. So I was happy to see her again today. And what we heard from young women at this hearing, and we continue to hear, is the disconnect that seems to exist. Young women have often heard, see something, say something. So when they experience sexual harassment, most often in their community settings or in school, they are told to go tell an adult. And what they reported to us was striking in that they do go to report to that adult, but that the adult's direction to them doesn't align with what their expectation would be. We heard frequently that the adult response to their report of sexual harassment was, just avoid that person. If that boy is bothering you in the hallway, just don't go down that hallway. Find another way to go to your class. As a commissioner, as a mother, as a sister, as someone who cares deeply about women and girls, that's just not the right advice. That again puts the onus on that young woman, that she needs to alter her behavior. And so as a commission, we're working really hard to make a difference in policy and legislation. I will mention there is an act sitting with the House and the Senate right now about requiring sexual harassment training in the workplace. And that would both cover schools, higher education institutions, with a real strong focus on improving the data collection and increasing training so that we can start to reduce these types of experiences and impact the numbers. So thanks for having me today. Happy to answer any questions as well.
Thank you, Dawn. That was great information. Thank you for everything that you do too. So we would like to open it up for questions if anybody has any additional questions.
Yeah, sorry, Liz, I don't see any in the chat, but I would like to just give Attorney Dineen just another minute to talk about, with this COVID layer, the experience that the YWCA is going through, as she had shared some just really extreme, which is why this information I think is so important to get out. So Liz, do you want to just share a little bit more if you unmute?
So when I was speaking to Jessica earlier this week, I shared with her that at the beginning of the pandemic, the numbers were down in terms of people reporting sexual assaults or domestic violence. But as the pandemic has gone on, it has been absolutely astounding to see the level of violence that is being perpetrated against women within our community. Many women have come to the YWCA, our main office, prior to even going to the hospital or to a police department. So we've had people show up in our lobby with bruises all over their body, broken arms, black eyes. And typically when they come, they've come bringing a child along with them or a couple of children, and they have nowhere else to go. But what we have noticed is the extreme escalation of the violence. And we've been very fortunate that the Community Foundation of Western Mass has given us some large sums of money. So we've been able to house people in hotels for a period of time while we have tried to find housing. Because at this point, our shelter is full and we are to the capacity. So it's very hard to turn somebody away who comes to your place who absolutely is in imminent danger and is in a severe crisis situation. So we, the state, the Department of Public Health has also given us extra money to help women, again, to put them in local hotels. But that's not the solution, obviously, because they still need to get food and clothing and other things. So our staff has like satellite offices, meaning they are going to various hotels to bring food, to bring clothing, to bring diapers to the women while we work with them to find housing. And additionally, we got some additional money to get some new positions because of the increase of the domestic violence. So what I'm saying is we've been able to hire some additional counselors so that they can work with the women that have been victimized. But it's, I think we all on this call need to understand that because of this pandemic, there's an incredible amount of stress on people. People feel a lack of control in terms of when is this actually going to be over. And regardless of what your political affiliation is, it's been a very stressful election and after election. So the stress that people are experiencing within their homes and their lack of ability to socialize with friends and see friends, I think has put a lot of pressure on people, and men that might not have normally participated in egregious activity like beating or hitting or emotionally abusing their spouse or significant other have been doing it on an increasingly alarming level. So, and when I say women, we've had young women, 17, 18, 19, 20-year-olds show up here that have nowhere else to go. So it's very, very disheartening. It's, you know, I'm grateful that the Community Foundation as well as the state have been able to give us additional funds to help those women. But we have a lot of work to do in Hampden County in terms of educating young men. And we need to start really early educating young men and socializing them that it is not okay to physically, emotionally, and psychologically abuse girls and women.
Thank you, Attorney Dineen. So we have had a request if the presenters, if you're willing to share your email address, if you can put them in the chat. And also I'd like to turn it over to Jessica. Thank you all of you for presenting today.
Yeah, and thank you, Luz, so much for moderating and for all of you that have shared, you know, such important information. This report where we just feel was so important to get out there into the public, and at, you know, this time of COVID-19, it just feels like kind of the perfect storm. So with regard to moving forward, there's already been shared so much action and also so much need to continue with action. And so our hope is that we would convene our advisory board that helped with the report again and try to continue to disseminate information about programming, but also the policy work that Dawn referred to, and lifting up stories like Attorney Dineen and Cindy Miller and Dr. Hussey and everyone, and the voice of Ebony is just so important to hear from young women. So I just want to say thank you so much. Please support these organizations. Each of them deserve your support, and we encourage you to go to their websites and, you know, make contributions if you can. And I also want to just lastly say thank you so much to the Women's Fund of Western Mass and the Young Women's Initiative for picking this report to give some funding to disseminate this important information. So thank you all so much for your time today, and please be on the lookout for more information from us moving forward. So thank you again so much.
Have a great day.
Have a great day.
Thank you.